Question number 6, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Are all communities his priority for better, sooner, more convenient healthcare?
The Honourable Tony Ryle.
Mr Speaker, the Government wants all communities to receive the best possible health services. How these are provided in different communities will change over time, as we are seeing, for example, in Taihape, where the individual circumstances of a contracted provider can mean that services need to be provided in a different way.
Honourable Ruth Dyson.
When he told district health boards earlier this year that 2010 would see him target primary care, did he mean target for scrapping, including stripping elderly couple Joan and Lou Campbell of their right to live near their daughter in Taihape?
The Honourable Tony Ryle.
Mr Speaker, this is of course a concerning time for the people of Taihape. When a provider can't carry on, then there's always uncertainty. What is certain is that the Whanganui DHB is working closely with the liquidator, the PHO and other interested parties to ensure the health needs of the community, particularly the elderly, are met. The DHB has been working with the Trust to help them onto a firmer financial footing, including writing off back rents of $450,000, outside financial expertise and other support over and above the normal payment for services. I'm advised this additional support totals over $1 million.
The Honourable Ruth Dyson.
How does making frontline nurse Donna Wood and midwife Angelique Tucker redundant and leaving their community in Taihape without their services make anything more convenient for local residents?
The Honourable Tony Ryle.
Mr Speaker, it's very important that the member understand the full transitional arrangements that are underway. It is proposed that the midwives will be employed by a different entity, and the District Health Board advises that the primary maternity services will continue and that the families of Taihape will receive the same services from the same midwives in the facility. The DHB has been working very closely with the DHB. When a provider can't carry on, it always with the Trust, and when a provider can't carry on, it's always a difficult time for a community.
Nikki Wagner.
Mr Speaker, to the Minister of Health, are all communities in the Wellington region a priority for better health care? If so, what decisions have been made to deliver this?
The Honourable Tony Ryle.
Yes, Mr Speaker. Yesterday the Government announced the chairs, deputy chairs and members of the District Health Boards, including a joint chair for the Hutt and Capital Coast Boards. This is part of the Government's drive for closer collaboration between boards to improve services for patients. These two boards are dependent on each other to be successful. Last year, 2,600 Hutt patients had operations in Wellington and 1,300 Wellington people had procedures at Hutt. It makes a lot of sense for these boards to work well with each other.
The Honourable Ruth Dyson.
Why did John Key promise Taihape residents on his visit just 1 month ago that everything would be all right, and yet now the locals are facing closure of their health centre with a loss of 50 jobs and all the services they provide, including primary care, maternity services, community nursing, allied health services and the closure of their only rest home?
Mr Speaker, the premise of the member's question is not correct. The fact is that services in Taihape are going through a period of transition because the provider can't carry on. The District Health Board, for example, was prepared to put well over almost $400,000 extra in on an ongoing basis, but arrangements are being put in place to make sure that services can continue as best they can and that the people of Taihape will be kept fully informed.
The Honourable Clayton Cosgrove.
Mr Speaker, the Minister, when he told the House on 29 July 2010, in response to my question about the termination of after-hour GP services in Rangiora, and I quote, "I'm advised that discussions are underway between Pegasus Health, St John and the Acute Demand Programme about improving services in that area, and that we hope there will be some announcements following that shortly," unquote. Was he aware that the services in the deal that he and his colleague Kate Wilkinson were claiming to have brokered already existed? And does he really think that over 8,200 people who signed a petition calling for the government to reinstate a service they have had for over 22 years won't see through his and his colleagues' false promises?
The Honourable Tony Ryan.
Mr Speaker, the premise of the member's question is simply not correct. Those services may have existed in Christchurch, but they didn't necessarily exist in the area of debate at the moment. They're working very closely to improve the situation there, and I think that there will be an outcome very positive for the community.
Question number 7, Pesatā Sam Lord 3.